Hi, I'm Zara Ranganwala, and in my psychology and film project, I'm going to talk about the perks of being a wallflower. So, I'm talking about the character Charlie Clemekis. He is starting his freshman year of high school in this movie, and he can be described as very shy, reserved. He doesn't have any friends. In the previous year, his best friend Michael passes away due to suicide, so he's pretty much alone. And background information about this movie: it takes place in Pittsburgh, Pennsylvania in the early 1990s, and in this setting, it reflects the mood and challenges of suburbia and high school life. It's centered around 90s nostalgia, which captures innocence as well as the angst of growing up during this time. There's a big emphasis on finding a community within a small circle of friends who accept your differences, which is prevalent to Charlie because he sees himself as an outsider. Charlie could be diagnosed with post-traumatic stress disorder, also known as PTSD, and this is a psychological disorder that stems from experiencing or witnessing a traumatic event. It originates from a multitude of factors, and the most prevalent factor is Aunt Helen, who molested him as a child, and following that, died in a car crash on his 7th birthday. And as I said before, in the previous year, his best friend Michael committed suicide by shooting himself in the head. And these factors lead him to experience flashbacks and dissociations throughout the movie. The stigmatization of PTSD. In the early 1990s, the treatment for it was less accessible for adolescents because it was more prevalent to veterans or extreme trauma survivors rather than adolescents. A therapist around this time would likely diagnose him with anxiety or depression because abuse was often unreported and misunderstood. Thinking about it in a relative perspective, his disorder might have been seen as a manifestation of the culture around him, which shaped the content of his symptoms. In other words, because of his adolescence, his behavior could have been perceived as dramatic or rebellious, which dismisses PTSD as just normal teenage angst. In Western culture, especially the United States, there was a lot of stigmatizations around PTSD. And as I said before, it was mostly the misconception was that it only affects veterans who were involved in physical combat. And it's often was seen as unpredictable. Well, the symptoms were often seen as unpredictable, fragile, or even dangerous. And the most prevalent stigmatization that Charlie faces is the association of shame, which acknowledges the trauma the victim faces, especially those who have childhood abuse. And this prevents them from wanting to receive help because they don't know how to talk about it. His most noticeable symptoms are flashbacks or dissociation. When Charlie is in a more emotional state, he feels as if his traumatic events are reoccurring, which leads him to lose complete awareness of his present surroundings because he's stuck in that memory or trauma that happened. And he also experiences derealization, which he falls into a dissociative state and his surroundings are seen as unreal or distorted. An example of his derealization is he sees his friend Patrick getting beat up in the cafeteria by a group of boys, and he then blacks out and fights everyone hurting Patrick, but has no recollection of what happened after that immediately. And that's an example of derealization. His less noticeable symptoms is absorbed processing, which instead of dealing with his trauma, he tries not to think about it, but the thoughts it's difficult to suppress, and that kind of ties into the flashbacks he gets. And the entirety of his trauma gets revealed when he's with Sam, which is the girl he's in love with. They're in her room, and she places her hand on his thigh, and he immediately goes back into a dissociative state and remembers all the times Aunt Helen would touch him inappropriately. The most effective treatment plan for him would probably be trauma-focused cognitive behavioral therapy, which is centered around dealing with traumatic memories, overcoming maladaptive thinking, and aids in developing effective coping mechanisms. An ethical concern could be respecting Charlie's autonomy and consent. He may struggle to talk about what happened because he valued his aunt so greatly while also feeling shame about the situation. A therapist can help him get past this by guiding him to equip the necessary skills in order to help himself and come to terms with what happened. An internal barrier is Charlie's reluctance in confronting his memories. And because of the stigma in the 1990s setting, therapy for trauma, especially childhood abuse, could be viewed as weak. There's a scene when he wakes up in the hospital after a suicide attempt, and he tells the doctor he doesn't want to be there because he doesn't want to be one of those weird hospital kids who are in like an institution. And the doctor then helps him realize in order to prevent these episodes of dissociation, he needs to accept the fact of what happened and accept help. Opinion had a very accurate portrayal of PTSD. It exhibits common symptoms of a victim of childhood abuse while also showing how these past traumas affect his current relationships. It raises awareness and humanizes the struggles that many abuse victims face. It highlights the importance of seeking help and finding sanctuary within community. And that is all. Thank you.